Hey, take the one out. Okay, start back again. Okay? No. Okay, so yeah. What's the question again? Hi, I'm Dr. Navdeep.
And I'm Dr. Chong.
And we are going to be playing Jenga blocks today while answering some fertility related questions.
Age is actually one of the most important factors for couples trying to conceive. Okay? This is true for both men and women. This is the so-called biological clock. For men, it's a factor, but it's not as bad as the ladies.
To answer it,
Yes.
push the thing out. Oops.
Okay. For ladies,
I feel very confident in the beginning. Oh.
okay, for ladies, after 35 years old, you tend to see some aging, especially with the egg qualities. So that's why that is for the reason why we find that miscarriages starts going up significantly after the age of 30.
First, the husband should go for his sperm assessment, sperm test, and the wife, the female partner, should go for an ultrasound scan to assess her womb and ovaries, and also she should be sent for a hysterosalpingogram to assess her fallopian tubes, and subsequently she should go for go for a blood test. The blood test will include the anti-Mullerian hormone and the thyroid screen, prolactin, to ensure that she's healthy. Okay, and they also should go for a general medical assessment, check for diabetes, okay, any blood disorders. And that's what you should do. Your turn, Dr. Chong.
Well done. If the male is overweight, usually that brings a lot of some medical problems. For example, diabetes, or it also reflects a very sedentary lifestyle. Okay? So when we know that sedentary lifestyle is associated with poor sperm health. Okay? For the lady side, if she's overweight or underweight, it is also not good. If she's underweight, usually she's lacking in nutrition, the menses may be a bit haywire. If she's overweight, then she may also have PCOS.
Well, holistic. All right. Okay, PCOS cause their cycles to be very irregular. Okay. PCOS will cause their cycles to be very irregular. Okay, hence they're unable to find their fertile period. So in view of that, you'll have a bit of difficulty, and secondly, they don't ovulate regularly. So they'll be required to take some medication known as ovulation induction or medication to grow eggs. Go from back. Yeah. I can't fit my finger. And as for endometriosis, okay, they'll have times you can have cysts, and they can get adhesions, which will cause a lot of. And as for endometriosis, you can have cysts, which cause a lot of pain during the menstrual cycle. There's a lot of adhesions, which can affect their fallopian tubes.
Okay, first of all, before getting pregnant, lifestyle behavior number one, you have to make sure you do not smoke or drink alcohol, okay, excessively. If they live very sedentary life, that means zero exercise, they need to start being more active. As a sedentary lifestyle also is associated with reduced fertility. So, what was the question again? If they don't exercise, they will start exercising more often. Exercises, moderate exercise, especially in a male partner, is associated with better sperm quality. And for women who don't exercise, sometimes they have issues with being overweight as well as irregular cycles as well. Okay, egg freezing and sperm freezing technology has come a long way since IVF started 30 years ago. With our current technology, the eggs can be kept indefinitely. Recently, in the States, there was a lady who used